Hi, this is Dan Bootman, Voc Rehab Radio News, show number 3. And this time I'm just going to be a talking head. I'm going to let you know what I found out at the National Council on Rehab Education's conference in San Francisco. So I went to quite a few sessions, got some good CEUs, but I wanted to share a little bit of the information that I learned with you. An integrative person-environment interaction model for predicting employment outcomes. So this is Dr. Fong Chan and his colleagues, and he's looking at what predicts employment outcomes. And so just a couple things I want to mention. I'm certainly not saying everything he said, but on the environment side, the per state capita income is a predictor. If I said that right, is it per capita state income? I'm not really sure. So is the strongest environmental factor, followed by the urban population rate, although that just had a small effect, but still. The per capita income, or the state capita income, and then also some personal characteristics like, I believe, supported employment, but the change in education level. So as consumers gained education, that seemed to matter, and VRR services. Then I went to a session on the aging workforce, challenges and opportunities for providers and employers. Susan Brouillard, I can't pronounce her name. I'm sorry, Susan, if you're watching. Dr. Brouillard at Cornell University. Although she wasn't there, Judy Young and Michelle Maybaum led the discussion. But a few things I want to point out. I mean, if you have an older consumer base, some things to think about when trying to help them get employed. For example, possibility of working at home, and then a whole bunch of flexibility. Hour flexibility, flexibility with scheduling, with the career, flexibility with benefits, developing employer relationships, possibly training to upgrade their skills, and of course accommodations. So I thought these were maybe not surprising results, but nonetheless important to consider with this population base. Next, I went to a session. Dr. Chad Betters ran it on the State of Voc Evaluator, a national study. And what he was really telling us, he's telling us a few things, but what I picked up on was how do the Voc Rehab programs use Voc Eval services? And so, again, I got my cheat sheet here, but 99% of the states and some territories purchase Voc Eval services. 87% are using community rehab providers. 58% use private practice Voc Evals. 42% are using psychologists for Voc Evaluators. 7% are using others, but only 5% are using the state Voc Evaluators. And I think this says a lot about what the VR program is doing with regarding Voc evaluation. And then on the second day of the conference, I went to an ethics session. Actually, Dr. Scott Beveridge held a session called Ethical Dilemmas. Are there differences between the public and private sectors? And that's always interesting to consider because the kinds of clients, the kind of work that we do is going to differ. And we have a relatively new set of ethical codes, so how might that differ? So his findings are that in the public sector, we're mainly concerned, the ethical dilemmas anyway, are primarily in the areas of the counseling relationship and particularly the counselor's relationship to the client's family. In the private side, though, ethical dilemmas were reported as primarily in the new category of forensic services. And again, forensics is a new part of the code. Then I went to a session called A Role and Function Study of Rehabilitation Counselors Shaping the Future. This was led by Cindy Chapman of the Commission on Rehabilitation Counselor Certification. Dr. Mike Leahy, Dr. Fong Chan, and colleagues conducted a study digging into rehab counselors to find out what is it we need to know, what is it we do on practice. And it's always interesting looking at the results. I'm a little fascinated by these role and function studies. I want to know what is it we do kind of thing. Before I get to the results, I think it's important to say who they sampled. So about 37% were the federal state rehab counselors. After that, it was like 17% in some others category. It's really interesting to know who those others are, because we're practicing in some unique areas, and it'd be nice to know where that is. So the findings. Not some huge changes, but it lends some support that what we do and what we need to know is really consistent. So what we do is primarily job placement, vocational assessment, and career counseling. And that's been steady for some time. After that, we are doing counseling, psychosocial interventions, and case management. And after that, demand-side employment, workers' compensation, and forensic services. So what do we need to know? And there are 4 areas there. Primarily, we need to know job placement, consultation, and assessment. After that, case management and community resources. And then we have individual, group, family counseling, and evidence-based practice, which is upcoming in level of importance. And then finally, what we need to know is medical and psychosocial aspects of disability. So that's the latest role and function study. I believe it's going to be coming out in the Rehabilitation Counseling Bulletin fairly soon. And that's really the bulk of what I'd like to report for this conference. Again, I'm sure these authors will be disseminating this information in other ways, but I just wanted to report what I found. As usual, the conference was full of information, full of networking, fun, a little bit of good food, and nice weather in San Francisco. So this is Dan Bootman, Voc Rehab Radio. Thanks for